Thank you for taking a few minutes to join me today, Friday, August 27th, 2021. I'm broadcasting from the Anacortes High School Digital Media Studio, and I wanted to thank Dr. Irish and the Anacortes School District for welcoming me in to broadcast this message. As we close out the summer and welcome another school year, I want to take a few minutes to update our community, city and school leaders, residents, teachers, and parents on the effects of the pandemic on our community. This morning, I took a few minutes to review all 50 states of their pandemic rates. Washington State is one out of 9 states that are at or above the historic peak rates of the pandemic to date. Today, I want to talk to you about those effects on our state, our community, and our region. As we enter into the strongest surge, the 5th surge of our pandemic, as well as coming back into school where upper respiratory symptoms of our kids, the effect on our families, RSV is on the rise, and the beginning of the flu season, it is now more important than ever that we protect one another, ourselves, and our community. I have a number of recommendations I'd like to review with you today. Please get vaccinated. If you're 12 years and older, you qualify to take the Pfizer vaccine that's been FDA approved. Mask in public settings, especially in large crowds, from those outside of your immediate family. Social distance if you're not feeling well. And if you're not feeling well, seek the care of your provider. And finally, for those high risk, those with underlying conditions, immune compromised, 65 years and older, please take extra precautions. Wear the mask in public settings. Be careful on who you're around. If you see others that are not feeling well, distance. As we take a look at our journey in Washington State, here's where we are. We're at the highest peak levels of the pandemic. We see back last winter during the December and the January holidays, we had a significant surge. This was the moment where the vaccines were introduced to us, to our community. And over the last 8 months, we've worked to vaccinate our entire state. But when we look at it a little bit closer, in Skagit County, you see that peak in December and January. And today, here in August, entering September, we are above that peak. We're at the highest infection rate of COVID-19 pandemic to date. The left slide right there talks about per 100,000 over the last 2 weeks, we have 538 cases and rising. To the other slide, to the right, you'll end up seeing our admission rate per 100,000. Over the last 2 weeks, you'll see we're at the highest above our peak levels of last December and January. 16.9 admitted patients. This is true for us at Anacortes, at Island Hospital, as well as in the surrounding areas. We meet on a regular basis with all hospital leaders of Washington State, especially the ones within our region itself. Many hospitals are saturated or at capacity with long wait times, waiting to get admitted or be seen by a provider. We take a look at the vaccination rates. Right here, this is the vaccination journey that we all were on. The beginning is January 2021, when the vaccine was introduced into Skagit County. And you see, as we struggled to get the inventory, to get the vaccines into our community, to get other vendors opening up alongside of Island Hospital, get our community vaccinated. We did a great job in that initial push, but come June, July, the demand for the vaccination reduced. Those seeking to be vaccinated was less. Our journey now today, knowing that we have about 35 to 40% of Skagit County residents, we'll review that here in a moment, have not been vaccinated. And those that are being admitted are the unvaccinated by its majority. Right here is Skagit County vaccination rate. We know about 72% of Washingtonians are vaccinated. Here in Skagit County, as of August 23rd of this year, 58.5% of our population has initiated the vaccine. 52 are fully vaccinated. And when we take a look at our adolescents and above, 16 years and older, 63% of our kids are vaccinated, and 12 years and greater, 61%. 35 to 40% of our young folks are not vaccinated. To the right, you'll end up seeing age groups. The light blue represents vaccine initiation, the first of the 2 shots if you're taking Moderna or Pfizer. And to the right, the darker blue represents fully vaccinated. As of this week, between the ages of 12 to 17, you see 35% of our kids in our county are vaccinated. We have a ways to go. Our goal is to get our kids, our community vaccinated, to be able to protect one another, and in so many ways, keep our kids in school. And speaking a little bit earlier about our region's hospital capacity, that's true here at Island Hospital as well. Our emergency department is full. Much of it is with COVID or COVID symptoms. We are in that season of flu, and we're starting to see remnants of those flu symptoms. We're seeing RSV in our young people starting to rise a lot earlier than in the past. We're at critical staffing where our staff are been working for about a year and a half through these stressful conditions, caring for those that are ill or injured, being exposed to COVID and having the stress and the strain of coming home to their own families. We too are working closely with the Department of Health and the Governor's Office, as well as our Public Health District, to vaccinate our healthcare workers. And I know that this in itself is a challenge for many people, taking the vaccines, understanding the COVID virus and how it affects our community. And there's a lot of misinformation out there. But for us and for our healthcare workers and our hospital, it is real. Right here, these are the positive cases over the last couple months that we've tested. 24 positive cases in June 2021, July 2021, 55, and this month to date through last night, 153 positive cases. More and more people are becoming sick. Up until this month, Island Hospital hasn't had a single death in the hospital. This month, we've had 4. COVID is real. It affects our families, it affects our health, it affects one another. People are sick, their lungs hurt. By the time that they get COVID positive admitted to the hospital, most of them are, at this point, are unvaccinated. They are asking for the vaccine. At this point, we're not able to give the vaccine until after they become well. There's many questions about the Delta variant that's out there, how prominent it is within our community, within our region. The majority of the cases, from what we can tell, not all cases are tested for the Delta variant, but many of them are at the state level, and we see that the majority of the infections are Delta variant related. What are we seeing with this Delta variant? What we're seeing is it's having further breakthrough cases. What is breakthrough cases? Breakthrough cases are those that are vaccinated and still get COVID virus. So we're seeing the Delta variant being more prevalent also in the vaccinated individual, where the symptoms are stronger, whether it is upper respiratory symptoms, a headache, fever, GI, body aches, all sorts of symptoms that we have. The Delta variant seems to be more potent as we move forward. How do we protect ourselves? I go back to those original recommendations. Get vaccinated. Wear a mask. socially distance, avoid loud crowds, wash your hands often. I want to talk to you about two topics that have been recently on the rise: the COVID breakthrough cases and booster shots. When thinking about COVID breakthrough, what is it? It's vaccinated people who are infected with the COVID-19 virus. Vaccines reduce the likelihood of being admitted to the hospital, and vaccines reduce the likelihood of death. It does not prevent you from getting the COVID-19 virus. No virus is 100% effective. We've seen in the Pfizer and the Moderna about a 91 to 95% effective rate, and a little bit less for the J&J. What the vaccine does, it helps prevent high symptoms that cause admissions to a hospital and death itself. The risk of infection, hospitalization, and death are much lower in vaccinated compared to unvaccinated people. There's questions out there about the booster. Is it immediately available? It's not. Here in the near future, as we work closely with the federal government and the Department of Health here in Washington State, we are putting together guidelines on who gets that booster initially. Right now, it's anticipated those that are immune compromised will be those that get the booster first, followed by a regular regimen up to 8 months and past those that got the original vaccine. And right now, there's a lot more questions and answers on the booster shot. So as we move forward, we too look forward to guidance on how that booster shot will be allocated, who will get it first, who will get it second. We'll do all that we can to keep you updated as more information arises. Testing. A couple months ago in June, much of the testing was standing down as the vaccine rate went up. It was a logical step in this pandemic. Now that almost 70% of Washingtonians and 63% of Skagit County residents are vaccinated, we're seeing a surge. As we work through this fifth pandemic wave in our community, please get tested if you're not feeling well. Upper respiratory symptoms, GI, body aches, even fever. If you're feeling those, get tested. Skagit Public Health has announced this past week the reopening of the fairgrounds for testing and vaccines starting next week. In Mount Vernon, Rite Aid is there for testing. Walgreens in Anacortes, Burlington, and Sedro-Woolley. Northwest Lab in Burlington Outlet Mall. Skagit Public Health at the testing ground. They do not do travel testing. And even here at Island Hospital, whether it is in the provider's office, in the walk-in clinic, or in the emergency department, we have the access tent as well. We provide that testing. We've done a great job in partnering up with our new chief, Chief Bill Harris, in beginning a program of mobile testing and in-time vaccination with our fire and EMS department. We are ramping those up in partnership with them to help better serve, test, and in the future, vaccinate our community. Where do you get the vaccine? Plenty of places to get the vaccine. My wife and I and 13-year-old daughter are vaccinated. My daughter got vaccinated recently. They're at Safeway. Thank you, Safeway, for helping vaccinate my family. Rite Aid, Walgreens, the public health grounds, as well as here at Island Hospital and the primary care clinics, walk-in clinics, and here in the near future, vaccinating those that qualify upon discharge when they're admitted. I come back to this slide right here, a very important slide. We are in a crazy season where COVID is surging. We're going back to school. The kids' germs are here. The upper respiratory symptoms are here. RSV is on the rise, and we're entering in that flu season. I'm asking you again, please get vaccinated. For 12 years and older, please come get the Pfizer vaccine. We have Moderna and we also have J&J at the hospital. Mask in public settings, large crowds and around people not from your immediate household. Socially distance if you're not feeling well. And if you're not feeling well, see your doctor. For those of high risk, 65 years and older, and those with underlying conditions, immune compromise, please take the extra precautions. Now is more important than ever that we come together as a community, get vaccinated, mask up, protect one another, protect your family, and protect your community. I want to thank you for taking a few minutes with me today to take a look at the conditions within our region, the effects of the pandemic, and these recommendations that I'm asking you to follow. There's not complete answers at this time in the journey of this pandemic. This is something that we are learning as we go. But what we do know is that many parts make up that solution. Being vaccinated, masking, socially distanced, and making wise decisions all contribute to help and protect one another. For more information, please log on to our website, islandhospital.org. Thank you for taking a few minutes today. Thank you.